So at the Chiropody Clinic in Enfield, we're seeing more and more patients who are suffering from diabetes. And you've probably read lots about this in the news recently. Lots more cases are being diagnosed than ever before. And diabetes can be classified into two groups, which is type 1 and type 2 diabetics. Type 1 are patients who their body has stopped producing insulin, so it doesn't produce any at all, and type 2 where it produces some insulin but not sufficient for the body's use. Insulin is really used to accommodate the glucose in the bloodstream and to use it properly. And if we don't have enough insulin, a patient could get very ill very quickly. So why is diabetes so important to the feet? Well, it's because various illnesses that can be created by being diabetic. One of them is where you can start suffering from arterial sclerosis, which is a thickening of your arteries, which can cause some heart disease. And arterial sclerosis thickens the arteries and produces a poorer circulation around the body. The feet being the furthest point from your heart means that the lower legs and feet can be affected more severely than anywhere else. With a poorer circulation to the feet, a patient can start suffering from peripheral neuropathy, which is a lack of sensation in the feet, which means that you may not be able to feel a hard object or something sharp in your foot. You lose that sensation to feel pain, and that can be very detrimental to your health. So here at the Chiropody Clinic in Enfield, we like to have a close relationship with the patient's doctor and their nurses if they're diabetics, and we have a range of treatments we do with our diabetic patients. We regularly check their sensitivity and the vibration they can feel with various gadgets that we have. So we can use tuning fork here. This is something we use on parts of the foot and the lower leg for the patient to see what their sensation is to vibration. And we use one of these monofilaments as well. This we prod onto the foot to see in various parts of the foot to see what their sensation's like. So working with a monofilament, we test various areas of the foot, and this is to see whether there's any sensitivity to the touch, and the patient would always say yes or no when we touch the foot, as this patient will do.
Yes. 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 No.
Okay, so this patient has got a lack of sensitivity in this toe, and that would be something that we'd have to look at and maybe advise their GP for the patient to have a blood test to see whether they've suffering with diabetes. So if you're new to diabetes or you're worried about suffering from diabetes, come and see me at the clinic. Look at my website, www.thechiropodyclinicenfield, and look at my blog on diabetes.